All right. Thank you very much, Gregor. I would like to thank the symposium organizer for their warm welcome and for providing me with the opportunity to present the finding of our study. So, as you know, the great potential of mass media campaigns lies in their ability to propagate simple and focused messages to large audiences repeatedly over time at a low cost per person. However, media campaigns targeting illicit drugs have been seldom evaluated and their effects are largely unknown. This is likely to provide some issues from several perspectives, from the ethical, public health, and economical perspective. From the ethical perspective, is it a good thing to implement some media intervention to a population which is healthy before testing whether it works, whether it does not work, or whether it has a harmful effect? From a public health perspective, is it sensible to implement an intervention which may actually increase the consumption of illicit drugs? And from the economical perspective, it is sensible to spend public money in a way that may be effective, but may also not be effective. So, in order to provide policymakers, practitioners, and the general public with some summary of the available evidence, we wrote a systematic review. The objective of our review was to assess the effectiveness of mass media campaigns in preventing or reducing drug use, or the intention to use illicit drugs among young people. We wrote a Cochrane systematic review. What are Cochrane systematic reviews? They are reviews of primary research in human healthcare and health policy, and are internationally recognized at the highest standards in evidence-based healthcare. They investigate the effects of intervention not only for prevention, but also for treatment and rehabilitation. And they also set the accuracy of a diagnostic test for a given condition in specific groups of patients and in specific settings. Cochrane reviews are published in the Cochrane Library, which is an online collection of databases that bring together rigorous up-to-date research on the effectiveness of healthcare treatment, prevention intervention, as well as methodological and diagnostic tests. As of today, there are over 5,000 Cochrane reviews currently available in the Cochrane Library. For our work, we published a protocol in 2011. This is particularly interesting because what distinguishes, one of the few aspects which distinguish Cochrane reviews from non-Cochrane reviews is the fact that the protocol is published before starting to write the actual review. This is particularly good because sometimes researchers tend to adjust the methods according to the findings. By publishing the methods before starting the review, it is possible to overcome such limitations. In our protocol, we set a few selection criteria for our study. We decided to include all studies assessing the following outcomes: use of illicit drugs, which was our primary outcome; intention to use illicit drugs, which is known to be a proxy for future behavior; and other outcomes such as attitudes, knowledge, and perceptions about drugs. We included all of the following study design: randomized controlled trials, cohort studies, interrupted time series, and control before and after studies. I will explain briefly what we mean by that. We didn't set any time constraint. We didn't set any language constraint. And we decided to include both published and unpublished studies by establishing direct contacts with study authors. This is likely to reduce the risk of a particular kind of bias, which is publication bias. Sometimes researchers tend not to publish studies which provided evidence of ineffectiveness. And by including also unpublished studies, we are more likely to overcome such limitation. So we included randomized control trials. What are RCT, or randomized control trial? That basically, in its simplest form, that basically one kind of study design in which subjects are randomly allocated either to an intervention group or to a control condition, which is usually which usually includes people not receiving the intervention. So they are allocated with a random procedure, and that's the key feature of randomized control trial. Cohort studies are very similar, but people are not allocated randomly. They are observed as they are. So if people decide not to watch a particular media campaign, they will be automatically allocated in the group which was not or was allocated or was weekly exposed to the campaign. We also included another kind of study, which is interrupted time series. Basically, it's a set of several studies conducted before and after a particular campaign. As you can see from the plot, before each dot represents one study. So we can see that before this campaign, prevalence of marijuana use in the past 30 days seemed to increase, whilst after the campaign it seemed to decrease. So in our review, we conducted a search in several sources: the Cochrane Center Register Control Trial, Medline, Embase, Progress Dissertation and Thesis, and several additional sources. We retrieved approximately 18,000 records. We read the title and abstract of each of such 18,000 studies. And we selected for inclusion 19 studies, which were, their full text was assessed for eligibility. And finally, we included 19 studies in our review. What are the findings? All of such 19 studies were conducted between 1991 and 2013. They involved approximately 180,000 participants. They were conducted mostly in the US, but 2 of them were conducted in Canada and in Australia. And 8 of them were experimental studies, which means that the subjects in that particular study were aware that they were in a study, that they were exposed to a media intervention for scientific purposes. 10 studies were instead field studies, closer to real-life conditions. Subjects in such studies were exposed to the media campaign anyway, and the study had just the purpose to assess the effect of the media campaign on behavior and intention to use. And then we had one mixed study, which was both experimental and a field study. What about intervention? 11 were multi-component. 3 involved TV, radio advertising, and printed advertising. 8 involved TV, radio, and printed and internet advertising. And 8 interventions were mono-component. 4 involved only TV, radio advertising, and 4 involved only internet advertising. All of the interventions were grounded in several heterogeneous underlying theories, spanning from individual level to environmental level theories. The comparison groups were also kind of different. In 13 studies, the comparison group was no intervention. In 4 studies, the comparison group was lower exposure to the same intervention. In one study was another intervention, and in one final study, it had the two comparison groups. One comparison group including another intervention, and another comparison group including no intervention. We tried to summarize all the available data by summarizing the information regarding the experimental study. So, with regard to use of illicit drugs, we didn't find any evidence of effectiveness of media campaigns evaluated with an experimental study. With regard to intention to use illicit drugs, we didn't find any evidence of effectiveness of media campaigns. However, there is some sign of some possibility of an effect which favors the media intervention. However, the number of studies involved was too little, only 3 studies, and therefore it is not possible to draw reliable conclusions. And then we also did a pooled analysis using a multi-level logistic regression model of several studies of the MET project. And we didn't find any evidence for post-month use of methamphetamine. And we found some evidence of reduced use for people aged 12 to 17, but not for people aged 18 to 24. This is about past year use of methamphetamine. And then we also had 6 individual studies. What are the conclusions? Media campaigns have been successfully applied to reduction of tobacco use and promotion of road safety. However, in our review, pooled analysis and narrative synthesis provided mixed evidence of effectiveness. 8 interventions evaluated in an experimental setting provided no evidence of beneficial effect. 4 interventions evaluated with 8 field studies revealed some evidence of beneficial effect. However, 2 interventions were found to have iatrogenic effects. So, even though we could include only a limited number of studies, I think that we can already draw some conclusion. We can already learn 2 lessons. At least 2 lessons. One is that evaluation of mass media campaign is possible, is feasible. And it can be done not only on recall, not only on attitudes or intention, but also on actual use of substances. And the second lesson is that some campaigns may have adverse effects. Therefore, we can put all the 2 things together, and we can say that caution is needed when disseminating mass media campaigns to prevent drug use because of the risk of adverse effects. And large studies conducted with appropriate methodology are strongly warranted to consolidate the base of evidence. If possible, new media campaigns which are administered to a healthy population should be implemented in the framework of an evaluation study, just to avoid possible harmful effects to larger populations. I would like to thank Gregor Burkhardt and Alma Jamati for collaborating in conceiving the protocol for the review, as well as several other people, including many authors of the studies that we included, which provided us with useful advice and, whenever possible, with the studies and possible data, and unpublished data. Thank you very much for your attention.